예, 반갑습니다. 저는 백신을
Good
두
to see
번을
you
다
all.
맞았거든요. 근데 이게
And I got vaccinated twice, and when I keep my mask on, I just I have issues with my glasses, so please understand. Vaxel Bio is a company which is more than 10 years old, and as a co-founder, I work with Professor Lee Jae-chung, and who um, entered the same medical college to my a few years later, and I do hold MD degree, but I do not cover patients, but I engage myself in the research and work on biotherapeutics. And we founded this company together. And the key strength that Vaxel Bio is that I focus on basic medicine and mouse samples. And my co-founder focuses on human patients. So the strength is that unlike other startup companies that have difficulty entering the hospital market, but we have this key advantage here. And as CEO Zhang mentioned, when engaging in this research for over 3 decades, whenever there is any challenge, that I do get a lot of help. And basically, our company, Vaxel Bio, other former companies showed preclinical data, but our company, our focus is that under the given circumstances, our key strength is in that era. So we focus on clinical phases, and we have business developing strategy in that too. And we have 10 mottos, and we remind ourselves every time we have a business meeting, and one is that make our patients alive. So our goal is to keep our patients alive. Vexel Bio, based on this, when we worked on IPO, we got this skeptical question. So when in terms of immune mechanism and based on immune mechanism, when we try to kill tumor cells, if we purely concentrate on one part, it doesn't work. So that is what we learned over the past 30 years. And I often make a joke when if one person says I'm going to overcome cancer with one single treatment, then it's either this person is doesn't have any background knowledge, or either this person is a scammer. So in order to develop a cancer treatment, we consider all the multi-factors, and we take a multidisciplinary approach to come up with a pipeline to effectively treat our patients. And from innate immunity to adaptive immunity, we cover all of these three ideas based on our pipeline. And when we first began our clinical study, is in order to connect innate immunity and adaptive immunity based on our platform. And similarly, this may sound primitive, but just like GI innovation, we use cytokine as part of our pipeline. So ultimately, these all attack tumor cells, and we have to keep patients alive, and that is our key. So first of all, the pipeline that we have, we just completed our phase 1, and we're working on our phase 2 clinical trial. And our goal as an NK therapy is that we kept advanced carcinoma. And if you put it simple in simple language, it's just terminal cancer. So those patients have already received a lot of other cancer treatments, and they came to us. And we, in terms of human microenvironment, we just physiologically, if we let this cancer cell let it go, then we don't know what will happen. But if we abruptly change this, and if we inject NK cell into that room, then NK cell will effectively kill tumor cells. So our strategy here is that HAIC, which is hepatic arterial infusion chemotherapy, and we inject this. We inject this tube and inject this drug, and itself will kill tumors, and it will suppress tumor, and it will change the environment. And we find this vacant room, and we use this chemotherapy, and we extract blood from patients, and within 2 weeks we inject this. And compared to other peers, we conducted research, and the dose of our administration is fivefold or tenfold, and it is effective. And the way to make people survive is that we have to secure this pure technology, and we have to secure safety. So we increase our dose to increase the efficacy, and that is our strategy. And so when we gave it a shot, for those terminal carcinoma patients, and there is medicine called phenomena, a terminology. So it can prolong patient's life for 3.3 months, and worldwide this has been tested, and it is written on Wikipedia. But this can only extend life for 3.3 months, but the response rate is only 11%, which means only 1 out of 10 patients can survive for 3 more months, so only 10%. But when we adopted this technology, the response rate increased to about 73%, and the efficacy was about 81%. So, and another noteworthy characteristics is that the life prolonging characteristics. Of course, we did expect some bright efficacy, but this was more than we expected. And January was the last time that we did follow-up research, and based on that research, we could prolong patients' life for 40 months. So our patients are still alive. So in real-world data, it's probably even better than this. So, and also, if you take a look at the left, there is no severe side effects at all so far. And here is an example. If you see these arrows, and you can see that cancer reoccurred. But after our treatment, when we took a picture, the tumor disappeared, and the markers dramatically decreased. And our patients, there are patients who decreased the tumor size even more. So I show you these two pictures to show the difference of tumor size. And we began our second phase, and the second phase clinical trial is slightly different from the first one. And we have our know-how and our technology, and we increased our technology and expanded our knowledge. And when we extract cells, especially from cancer cell patients, and if we freeze that and melt it, and if we try to administer that, then usually the activity, more than 10%, is gone. And like 20% is a very important factor, so we have to do our best to keep the efficacy. So, and we built our know-how. And compared to phase one, we decided to increase it, and we administer this agent for 5 times, and within 1 month of period, we got approval, and we began our clinical trial. And when we changed this protocol, we got approval from KFDA, and we select patients, and we increased the dose twice and conducted the evaluation study. And If they approve us and tell us, then we can move on to the next stage, and that's the processes have been done. And next week, we will move on to SRM, and we will notify this information in the next stage. And when we got approval for two groups, and thanks to our good news, there are 4 more hospitals that wanted to adopt our technology. So I guess it'll propel the speed. And next is DC. And Professor Lee has been conducting this research for very long. And when we first conducted clinical trial, and this would be the research. So our DC is a very strong one, and we did confirm that efficacy. And then we conducted clinical trial in this way. And Professor Lee, I would say, has secured the most um, number of patients of this, and we did got a treatment, and we just completed 2A clinical trial, and we're moving on to 2B clinical trial. And next one is another thing, which is CAR treatment. And we are working on developing a CAR treatment. And of course, among our developments, there are CARs for multiple myeloma, for example, CAR T. But in fact, that field, from my perspective, there's Professor One, but in terms of hematology treatment, Curacell or other companies are already spearheading in that field. So it's a very bloody red ocean. So we would rather concentrate on developing solid tumor treatment. So there are about 4 CAR T developments, and we are currently conducting animal experiments, and we're conducting various tests. So I'll just briefly introduce one here. Compared to hematology cancer, a solid tumor, there is high level of antigen escape. So if single histronic CAR is used, then the efficacy is really low, according to various research. So if you combine different CARs or work on multi-system CAR, then if you try to do so, and this SCFB size, actually, if you inject this into a cell, then it doesn't fit well. The bigger it is, the more difficult it is to inject in a cell. So we came up with this monobody system, which is 1/3 of the size of the conventional one, and we conducted this on animals. And when you use this, you can come up with multi-cistronic construct, and you can target this carcinogen, and you can overcome various conventional challenges thanks to this CAR T technology. You can increase the efficacy. And this is our cash cow, Bio15, as you know, can increase NK cells and proliferate it with cytokine. So we developed cancer treatment for puppies, and nowadays cancer treatment market for animals is significantly increasing, and compared to people, dogs get a lot of cancer. There's some if you do the math, dogs may contract cancer 35 folds with more chance compared to human beings, and if they get older, even 50 times. So we conducted clinical trial and currently waiting for approval. And our tests result shows that the satisfaction rate of animal owners, dog owners, is almost 100%. And there are exceptions, is that there were patients who completely treated their dogs thanks to our treatment, and they didn't come back, so we couldn't ask their satisfaction. And as I mentioned, doctor, the way that autonomous survives is that we use protophase medicine, and we have to stick with the principal technology. And automation, smart factoring is the answer. So at first we would say Robert Schultz when he founded Starbucks, and when he said, "I'm going to sell coffee to the all around the world," and everyone laughed, "Ah, you're crazy." But nowadays, because of Starbucks, all the other famous coffee companies are just closed their business. So how you work on expanding your business changes the way you can survive. So we will build this smart factory based on a certain level of completeness, and I would suppose that this market won't be that difficult. So we will keep working on being autonomous. Thank you for listening.